Is Girihart Mallya. Joining me on the phone right now on Indiana in the Morning is Girihart Mallya of the Robert Wood Johnson Foundation, where he is their senior policy officer. Good to have you with us this morning, sir.
So nice to be here.
All right. Let's talk about the foundation you represent, the Robert Wood Johnson Foundation. How long have you and the University of Wisconsin been teaming up to put out this survey and study about the healthiest and least healthy counties in each state?
We've been putting out county health rankings now for approximately 10 years, and it provides a snapshot of health for every county in the country.
As far as things go, have you seen any trends develop over time as to which states are more healthier than others?
Yeah, what we do is we look at the health of every county in the country, and then we compare counties to other counties in their own state. So we can see, for example, that Indiana County in Pennsylvania is ranked 46th out of 67 counties. So it's in that bottom third of counties in terms of health. And generally what we're seeing is that people's communities have a big influence on their health, right? It's not just about whether you have access to good doctors and good hospitals. It's also about whether you have clean air and water, whether there are high-quality schools and good-paying jobs in your city or town, and then what the behaviors of its residents are as well.
Let's talk about some of those statistics in particular when it comes to state for health outcomes for Indiana County. You said 46th. You said lower third in the state. What are some of the areas that Indiana County has actually done pretty well in?
Yeah, that's a great question, and it's something that we do like to highlight. The rank is one thing, but then communities can really drill in on the site at countyhealthrankings.org and see where they're performing particularly well and particularly not well. So for Indiana County, it actually performs relatively well for the state of Pennsylvania on measures like high school graduation and even teen births. And teen births is a health issue that we're featuring across the country in this year's County Health Rankings data.
All right, so now that we've heard that, what are some of the areas that Indiana we'll say, improve on?
I think there are a few areas. As I mentioned before, the social and economic factors in a community have an outsized influence on people's individual health and the community's health. So there are a few areas where Indiana County could stand to improve, and I imagine they're not a surprise for many of your listeners. One is on rates of unemployment among adults. They're 7.3% according to our data compared to 5.4% for the state as a whole. And 1/4 of children in Indiana County live in poverty. And we know that those foundational issues about whether you have access to financial resources and whether you have access to a job can affect your health in the short term and the long term.
One of the things that I noticed in this study, not only does this study rank Indiana County as far as health outcomes, but also the factors as well. And as far as health factors go, from what I saw in the survey, Indiana County is pretty low on the list.
It is, and those health factors are some of the very things I was just describing. The social and economic factors, issues related to access to clinical care, the physical environment, and also people's health behaviors, whether they smoke, drink, and get opportunities to exercise.
We're speaking with Girihart Mallya, the Senior Policy Officer of the Robert Wood Johnson Foundation, about the study that they and the University of Wisconsin have done, ranking counties across the United States as far as the status of their health. Girihart, talk about how this data is compiled. What are some of the things that are looked at whenever this study is taken on?
So we really have a broad definition of health, as we've talked a little bit about. And we recognize that only about 20% of our health is accounted for by access to medical services. But it's these larger issues related to jobs, education, access to healthy and clean environments that contribute in really substantial ways to people's health. So we pull from public and private data sources that can give us access to information in a consistent way for every county in the country. And then we pull it all together to come up with these ranks for counties across the country.
Now that these rankings are released, what can county officials, I guess, or other people who are interested in this sort of data, what can they do with that data as far as using it to improve, I guess, the status of the county's health?
I think one main message is that information is power, and we have talked with so many communities across the country over the past several years on how they've used this data. So community leaders, community members, business leaders should go to countyhealthrankings.org, should see how their county is doing across all these measures, find places where it's doing well, find places where they could stand to improve, and then use the data to develop comprehensive plans to improve health in their city or town. So not only do we equip people with information and data, but we also provide them access to resources on what types of strategies are effective. So if we wanted to address unemployment or teen births, there's a feature called What Works for Health on this same website, countyhealthrankings.org, that reviews over 400 programs and policies and says, here's the evidence on whether it works, here are other communities that have done it, and here are some organizations that you can contact if you want more information to pursue those strategies in your own community.
So it sounds like you have heard of some success stories that have come out of this study.
We have. And many communities, before we started providing these data, just didn't have access to timely, rigorous, comparable information about health in their backyard. So we think having access to such information is the first step in moving forward to improve the health of your community.
Our guest has been Girihart Mallya of the Robert Wood Johnson Foundation. They, along with the University of Wisconsin Population Health Institute, have been putting together this study of counties across the United States concerning county health. And we want to thank you, sir, for joining us this morning on Indiana in the Morning, and we hope that you continue all the great work that you and the University of Wisconsin are doing. Thanks again.
Thanks so much for having me.